And we're back. Okay, so now we're going to move on to Module O, Critical Thinking. Okay, so our objectives are to describe the importance of the nurse aide using critical thinking skills, discuss the importance of critical thinking, and identify 5 questions that nurse aides should ask to think critically. Okay, so before we get into this lecture, I want to tell you guys a little story. Okay, so most college instructors or professors, we try to act like we are very, very intelligent, and we've never struggled with anything, but we all, we're all human. We've all had issues, problems. My problem academically has been geometry and trigonometry. Some of you out there may roll your eyes and say, of all things, this is what trips her up. Well, yes, that is what trips me up. So when I was in, we used to call it junior high school, but now it's middle school, I took geometry. And I had always been amazing, wonderful in math and every other subject. I've never had anything that stumped me up until that point. They really didn't have to study for things until I was introduced to geometry. For some reason, my brain just does not understand geometry, and especially trigonometry. And one day, I just had a meltdown, and my geometry teacher, her name was Miss Rocket. She was a tough lady, but she cared about me. She took me in the hallway and pretty much said, you need to get together. you need to calm down. And I told her, I said, I do not understand why I have to take this class. I'm never, ever going to use geometry for anything. And what she said to me, I did not like the answer then, but now that I'm older and wiser, I've given it more thought. She said to me, it's not the act of geometry that's important. It is training your brain to think outside the normal, to think outside the box. In other words, she was telling me that by taking geometry and, later on trigonometry, that I was going to be developing critical thinking skills, was what she was telling me. And that's exactly what critical thinking is. It is having to take the information that you have and then take the information that you've learned and marry the two. Okay, bring the two together. Meaning, you've got to figure some things out sometimes when there's gaps. And critical thinking will help you do that. I will end this section actually also with a story that hopefully will bring all of that together for you. So now let's look at some of these objectives. Describing the importance of a nurse aide using critical thinking skills. Looking at the importance of critical thinking. And again, we already said identifying the 5 questions. Okay, so critical thinking is exercising or involving careful judgment based on facts and observations. It is required to provide a safe, competent type of care to residents in a variety of situations. Let me just throw in there, what you're going to be learning in class is a textbook picture of what a normal resident or patient looks like. We're going to talk about just a very few abnormalities, but there's so many more problems that could happen outside of those abnormalities that we're actually going to discuss and get into. What's important when you're starting out in healthcare is to know what's normal. If you know it's normal, then when you see something that's not, then at least you're alerted that something needs to be done. We need to contact the nurse we need to look for additional information. So critical thinking is developed through real-life experiences, education, communication, observation, and practical application. So don't be very hard on yourself when you walk into a situation and you do not immediately know what's wrong or know what to do. This is on-the-job training kind of information that you're building, okay? As a very young new nurse starting out, I was very nervous. I felt very stressed, really overwhelmed a lot of times because I wanted to be ready for anything that happened, and that's just simply not possible. That's why you have more seasoned nurses and nurse aides around you. That's why you have a team of healthcare providers around you to assist you with building these critical thinking skills. It's incorporated into our thought processes and our daily activities. So we already do critical thinking, and we have our whole lives from childhood. We've built on our knowledge as we've gotten older, but we don't really think about it while we're doing it. Okay, so critical thinking allows the nurse aide to put theory into practice when caring for our residents. It allows the nurse aide to administer care in a safe, confident manner, requires the use of sound judgment in a variety of situations. The thing about critical thinking and coming up on these situations is that you need to make a decision quickly. You don't have time to stand and look it up in a book. I have heard that I have heard that one particular newly graduated nurse has shared that when she doesn't know how to do something, she looks it up on YouTube. Bad idea. Okay? That's not a good idea. Please don't do that. I can't stress enough. Do not go by YouTube on how to do something. Go get another staff member to guide you, to assist you. Okay? Okay, so helps the nurse identify situations that deviate from the norm. And really, at the base level of learning and getting into healthcare, this is really what type of critical thinking you're going to be doing. I'm going to teach you, and your other instructors are going to teach you about what's normal, and you just need to know what is not normal so you can report that and get somebody in there. Okay, here are some questions to be asked. What problem do I need to solve, and who should be involved in the process? A lot of times you have a patient who can answer questions for you. If you don't have somebody that's alert-oriented and can give you information, you may have a family member or a visitor that's there that could answer some questions for you. What information do I need? How do I determine that it is accurate? Vital signs. Vital signs are objective data, factual data. That's what we're looking for. How do I determine if it's accurate? What if you take a blood pressure and it's 80/40 and you think, wow, that can't be right? Well, take it again or get somebody else to take it behind you and see if they get the same thing. But do make sure your information is accurate. How do I solve the problem, and what are the advantages and disadvantages? And then lastly, once you've gotten all that information, what am I missing? What information do I need to try to find or get? Okay? Okay, so critical thinking is a way of thinking about particular things at particular times. Okay? This quote, it depends on what it means to you. To me, it means focusing on the problem at hand, trying to gather information not only from the current situation, but again, also try to blend that with what was I expecting to see? What vital signs were I expecting to get? What values? And then what could be causing those differences? That's what that means to me. Okay, and now we're at everybody's favorite slide, the end. Okay, so I feel like this story is important and pertinent. I know that it does make the video a little bit longer, but I think it really sums up what critical thinking is. Okay, so let me start by saying this does not mean that I did something spectacular. I did not. I was very nervous and scared myself in this situation. But I was working on a surgical unit at a local hospital several years ago, and I was standing at the front desk trying to print off some EKG strips for my patients. It was the beginning of my shift, and I was having some problems with the monitor as usual. I'm not really a monitor nurse. I don't care much for telemetry and all that monitor stuff, but I did have some patients on a monitor. So the charge nurse was standing at the front desk with me, and another nurse came down the hall, another staff nurse that I worked with, and asked the charge nurse if she could come and just kind of give her a second opinion and look at one of her patients. That her patient had a strange rash that she had never seen before, and that it seemed to just kind of come on all of a sudden. And this charge nurse turned to me and said, "Hey, I'll make you a deal. If you'll go down the hall with this nurse, we'll call her Jane, and you look at Jane's patient, I'll get these strips situated for you and in your chart for your doctor." Well, I was all for that. Okay, I'm a much more adept or good at on hands patient care than I am machines. So I went down the hall, and when I went in, there was a room full of people, loud, boisterous, laughing, and having a good time. And there was a patient in the bed that I had never encountered before. This is a new patient, not my patient. And the way I would describe her is she's probably in her 50s, 60s, so not old, but, what we would term that as middle-aged. Obviously, since we were on a surgical unit, she had some type of surgery, and I had not yet asked any questions about that. And she was petite, she was short, and she was pretty round. So she was heavy. She had a pretty round tummy. And so when I came in, I was not expecting anything serious. This nurse was not brand new, but she had been a nurse less than 2 years. And so she was doing, the right thing. She didn't exactly know what was going on, so she came and got somebody else to kind of give her a second opinion. So I went in and I was asking, where the rash was, and she said, "Well, it's on her abdomen." And I said, "Oh, well, let's take a peek." Well, I pulled the privacy curtain, because there's all those people in there. And myself and Jane, the other nurse, we pulled up her hospital gown, and on her tummy, lower tummy, was this really fine rash, where it looked like a rash. And I noticed immediately that, to me, it looked like what we call purpura. Purpura is a leaking of blood underneath the skin, and it kind of looks like little pinpoint purple dots or a rash on their tummy, or on the area. Doesn't have to be their tummy. And I pulled the sheet on down and noticed that this purple rash or purpura was also on her upper thighs. And Jane said to me, "That was not there on her legs when I came to get you," which then I had this piece of information that not only is this a new rash or finding, now this is getting worse. It's spreading. And so because I had the thought that this looked like it could be some internal bleeding, I asked Jane, "Hey, what kind of surgery did this lady have?" Because she did have a bandage on her abdomen right up above the rash, and she's told me she had a bowel resection. And I started putting all these puzzle pieces together. That's what critical thinking is. It's like just pulling all these puzzle pieces together. And when enough of the puzzle pieces get together that you can start seeing the picture, then you need to act. And I said, let's get some vital signs on her. And I was talking to the patient. The patient was alert. She was not having any pain. And while Jane was getting the vital signs, I was standing on the opposite side at the head of the bed talking to the patient. And let's see, we should name her. Let's call her Anna. And I said, Miss Anna, I said, how are you feeling? She said, I'm really sleepy. I'm really tired. And I said, well, I need you to do me a favor. I need you not to close your eyes. Don't go to sleep. I want you to stay awake and I want you to talk to me. Because the next thought was, what if this patient goes into shock? If she becomes unconscious, I am much more likely that we're going to lose her if she really does have internal bleeding. So Jane, the other nurse, said, Wendy, I'm having a really hard time getting a blood pressure. Her pulse is really erratic. And I said, we need to call the doctor. And Jane said, no, we need to call a code. And I said, you're right. We need to call a code. I said, I'll call the code. I said, you call the doctor. Or it could have been vice versa. It's been a long time, so I don't remember. I believe she called the code and I called the doctor, but it's irrelevant. Anyway, so that was what we together decided we were going to do. And she declined very, very quickly. I put oxygen on her. She did become less and less responsive. So we decided that while we were on the phone with the doctor, we were just gonna go ahead and take her down to the OR, because we both decided that was probably what was the doctor was gonna want us to do anyway, and it was. When we did get a hold of the doctor, he said, I'll meet you in the OR, get her down there as quick as you can. And so we did get her downstairs. We got her to the OR, explained to the OR staff, how we had found her, how she'd been declining, what her vital signs were, her oxygen level, all that stuff. Had her chart where we could tell them, what medicine she was on, what medicine she had already had, what medicine she needed. A pretty full gamut of report. And then we left, went back up to our unit. And Jane looked at me and she said, we're just going to leave her? And I said, Jane, our part of this is now over. I said, she's in the hands of the OR staff now. And I said, as hard as it is, we now have to go back up to the unit and we have to talk to her family, because her family didn't know what was going on. We just literally whisked her out of the room and said, we'll be back to talk to you, because it was so emergent. And so we went back up to the floor. I assisted Jane in talking to the family. Then we had to go back to our other patients, and that was very stressful. And I'm sure you want to know what happened to the patient once she was down in the OR. I'd love to be able to say that we got her down there just in time, and she was having some internal bleeding and they fixed it. But I'm afraid that is not the outcome that we got. The outcome was that the patient did die from internal bleeding downstairs in the OR, and it was absolutely nobody's fault. She had what they call just where the intestine had separated, the stitches or whatever didn't hold for whatever reason. And she did have some internal bleeding. It was, they could not get in there to repair it fast enough. So she did pass away. That's difficult. That's unfortunately something that you deal with in healthcare. Is sometimes, you go home at the end of the day and you're feeling great and everything was just, you just feel like you made such a difference in people's lives. And sometimes, even though you incorporate your critical thinking skills and you do everything right, and we did. There wasn't anything I can look back on that we could have done differently that would have made things a better outcome. Some days you go home and you think about it, you play it over and over in your mind. but eventually you realize that it's just one of those things that happens. Critical thinking is very important. There have been other times when, that things have come up and myself or another nurse, maybe caught something and we were able to intervene before there was, a poor outcome or a death. So just remember, the beginning of critical thinking is just knowing when to go get someone and let them know, hey, something's not right. Again, if you have any questions, give me a message by email, and I'll try to get back with you as soon as I can.